99 FM, your inspiration station. Welcome back to the show. Yes, I'm still here. I know in the top 5 plays, it does seem like Treza is gone, but I'm still here to keep you company for this last few minutes, and also to check out your MYD Heart, brought to you by NHP. Dr. Theo-Ben Kandetu, Ministry of Health Case Management Pillar for COVID-19, finally joins us to give us everything we need to know about the COVID-19 vaccine. So good afternoon to you, Dr. Kandetu, and thank you for joining us here at 99 FM.
Good afternoon, and thank you for having me.
It is a pleasure, sir. Let's, of course, start off things and talk about, the list of COVID-19 vaccines we currently have in Namibia and which ones we are still planning to acquire.
Thank you very much for that question. So the vaccines, the COVID-19 vaccines that we are currently rolling out in Namibia are the Sinopharm, as well as the AstraZeneca.
Mm-hmm.
The vaccines that we have planned to get in country, and that we are at quite advanced stages now in terms of procurement, are the Johnson & Johnson, the Sputnik 5, and we are also looking at the Pfizer vaccine.
Yeah. Okay, and what are some of the benefits and disadvantages, doctor, of each of these vaccines? If you could please just list that for us as well.
Okay, thanks. So generally speaking, the benefits, of course, are that all these vaccines, all these COVID-19 vaccines, have been proven scientifically to be both effective and safe. What I mean by that is they've been proven to be effective at preventing COVID-19 infection, and just to expand a little bit more on that, specifically preventing severe COVID-19 disease. And I think that is one of the greatest advantages here.
Yeah. To
say that if you take these vaccines, your chances, should you get the infection, of getting severe COVID-19 disease is very, very low with the vaccines. So what that means is, if you are to get infected, because you are vaccinated, you will not have to end up in hospital, have to end up in an ICU, and your risk of even succumbing from the disease are very, very minimal. Yeah. And when I say safe, is that again, all these vaccines have been tried and tested in clinical trials. They have been subjected to independent panel of experts outside of the clinical trials, and they've also now been approved by various what we call stringent regulatory authorities, such as CDC, FDA, and the WHO. Mm-hmm. So they are safe. So in a nutshell, those really are the advantages. Now, of course, the disadvantages are in the way of now what we call the adverse events.
Okay.
So there have been some adverse events that have been described with some of the vaccines, but most of these adverse events are mild. So it's things like pain around the injection site, headaches, myalgia, that's muscle pain or aches, nausea, vomiting, fever, and so forth. But like I said, in most cases, and this has been illustrated also in the vaccine trials, they are mild and they should resolve on their own in a couple of days. Now, of course, as we know, there has been a lot of literature, a lot of publicity around adverse events related to some of these vaccines. For example, the AstraZeneca, and very recently the Johnson & Johnson, in the way of what we call vaccine-induced thrombotic thrombocytopenia. That's basically just to say a phenomenon that causes thrombosis, blood clots, and low platelets. Now, although that has been described as we are rolling out to millions and millions of people nationwide, the incidence, the likelihood of you getting this phenomenon, this type of adverse event is extremely rare. We are talking about essentially 1 in a million. So that's 0.0001% chance. Although in the age groups, in the lower age groups, the younger age groups, it may be a little bit more frequent, but still extremely rare. So in those age groups, we are talking about 1 in 250,000, still extremely rare. So those are some of the advantages and the disadvantages.
Yes.
But our take on it, our stance on it as a Namibian government, and it's a stance that is also widely supported by WHO. It's the WHO stance. Is that in this instance right now, the benefits of the vaccine far outweighs the risk, the very rare risks in this case.
Okay. On the age groups, doctors, what age groups are able to take the vaccines which are currently being administered here in Namibia?
So currently, anyone who is 18 years old and above is eligible to receive either vaccine.
Okay, so either one you can get as long as you're 18 and older.
As long as you are 18 years and above. Yes.
Okay. All right, cool. And then finally, before we let go and say goodbye to you, Doctor, why should eligible Namibians get vaccinated? I ask you this question off air. A lot of Namibians, people around the world generally, are reluctant to take the vaccine. So why should eligible Namibians take this vaccine?
Right. So COVID-19, as we all know, has been declared as a pandemic by WHO with reason. Right. It is a virus. It is a disease that has decimated economies. It has led to the loss of livelihoods because of all these lockdowns and restrictions the world over. And most importantly, it has led to the loss of lives, of millions of lives. And has led to a lot of morbidity. So that's if you haven't lost your life, you have ended up with complications because of COVID-19. And right now, what we are seeing is the emergence of variants, which is very, very disconcerting for us because we've seen now that with some of these variants, it's led to an increase in transmissibility. That means these variants are linked to you getting the virus more rapidly. There's also many schools of thought now that have illustrated that some of these variants may also be lethal. So that is to say, if you contract the COVID-19 infection, you stand a greater chance of getting a severe form of the disease. You stand a greater chance of even dying if you are infected with this type of variant. So it's disconcerting really because it's impacted a lot of lives. It's led to the loss of lives. And now we have a potentially long-lasting solution that may even end the COVID-19 pandemic in the form of a vaccine. A vaccine that has proven to be both effective at preventing infection and certainly severe forms of COVID-19, and that has been proven to be safe. So my message here is that we should all get vaccinated, not just to protect ourselves, but also to protect those around us, our families and friends, our communities, and ultimately the nation, because COVID-19 does not discriminate. You can be asymptomatic and not even know it.
Yeah.
You can have the infection and not even know it, but pass it on, transmit it on to someone who stands a greater chance than you of ending up in a hospital on a ventilator, either because of their age, their advanced age, or
having underlying
profile.
Yes. Doctor, I actually have a few more questions for you, but because of time we're going to have to cut the interview short, but hopefully we can get you in again, just to get some more info, because I actually wanted to ask you this new variant, or this variants being picked up all around the world, specifically right now in India. And I wanted to ask actually whether or not this variant can also be then prevented with this vaccines that are currently out in the world right now. But I think it's a conversation for another time, and hopefully we can get you to come in again and make some time to come talk to us some more about the vaccines and why it is so important for folks to take it for their own safety, and like you mentioned, for the safety of the people around them and their communities. But thank you so much, Doctor, for coming to share with us this much needed information. If I would like to know more about these vaccines, is there somewhere where we can get more information?
Yes, absolutely. So the Ministry of Health and Social Services has a website.
Okay.
You can access the website. The information is rapidly available. It's regularly available on the website. We also have a Facebook page. Please do follow the Ministry of Health and Social Services Facebook page. There's a lot of information that is being shared there on a daily basis. And then of course we also have the various COVID-19 updates.
Yeah.
And we also have a PRO office at the Ministry of Health and Social Services. That's our public relations office. You can also reach us there. They would be able to give you any and all information. And then of course the very important number that the whole nation needs to remember, 0800 100 100. That's the emergency COVID-19 hotline. Please do also use that if you are also seeking
information and help.
Information.
0800 100 100.
0800 100 100.
That's correct. Doctor, thank you so much again for making time to come chat with us during 99.
And thank you for having me.
It's a pleasure. That is Dr. Theo-Ben Kandetu, Ministry of Health Case Management Pillar for COVID-19, and we were just talking about the various COVID-19 vaccines that are currently being administered in the country. And like I said, we'll try to get him in again. He is a busy man, but we'll try to get him in again to just shed some more light on a few more questions. But that's also the end of the show for today. Me saying goodbye for now. Tomorrow is a public holiday, but we are going to be on air with you. That's from the morning, Morris and Sibo from 6 to 9. 9 to 12 is The Kingdom with Script. Me and you from 12 to 3 on Hitsville. And finally here on The Pulse from 4 to 6. So until next time, I'm saying goodbye with Black Eyed Peas. Where is the Love on 99.